Welcome to the Night Radio and Television Station. Here come to the news today. The National Assembly has just issued resolution on state budget estimates and allocation in 2022. Specifically, in Resolution number 34, the National Assembly approved the state budget estimate for 2022 as follows. Total state budget revenue is 1,411,700 billion VND. Total state budget expenditure is 1,784,600 billion VND. The state budget deficit is 372,900 billion VND, equivalent to 4% of the GDP. The total bond amount of the state budget is 572,686 billion VND. The resolution clearly states postponing the implementation of salary policy reform as prescribed in Clause 3, Article 4 of the Resolution number 23 of the National Assembly, giving priority to adjusting pensions for people who retired before 1995. Continue implementing regulation on creating a source of salary policy reform to accumulate resources to implement wage policy reform at an appropriate time. The National Assembly excites the government to operate the fiscal policy flexibly and effectively, closely and seamlessly coordinate with the monetary policy to prevent and control the COVID-19 pandemic, and recover and develop socio-economically, contributing to stabilizing the macroeconomy and controlling the inflation. Prime Minister Phạm Minh Chính has just requested the Ministry of Health, relevant ministries and agencies to submit for approval the master strategy for COVID-19 prevention before the November 30th. The Prime Minister requested the Ministry of Health summarize and evaluate the prevention and control of the fourth pandemic wave and continue to complete the master strategy for the pandemic prevention and control, report to the government and submit the competent authorities for approval before November 30th. The Prime Minister also asked the Ministry of Health to consult and study experience from other countries to provide guidance on appropriate isolation for people who have had 2 doses of vaccine and tested negative within 72 hours. Urgently guide the socialization of testing and tested prices to suit the current situation and conditions. Coordinate with the Ministry of Education and Training and other ministries, branches, and localities to accelerate the plan to vaccinate children safely, scientifically, appropriately, and effectively. Plan to inject her dose. According to the Command Center for COVID-19 Prevention and Control in Đồng Nai Province, up to now, the province has more than 2.8 million people aged 18 and over who have been vaccinated against COVID-19 with the first dose rate 113.2%. More than 2.2 million people were injected with the 2 doses, reaching the rate of 89.5%. Xuân Lộc and Long Thành have reached a coverage rate of doses 2 of 104%. The localities with 2 doses over 90% coverage rate include Long Khánh, Cẩm Mỹ, Vĩnh Cửu. Particularly, Tân Phú is still the least with the rate of 75%. Regarding the vaccination against the COVID-19 for children aged 12 to 17, more than 234,000 children out of the total of more than 296,000 children were vaccinated, accounting for 79.2%. After vaccination, 7 cases of children has mild reaction, 1 cases of several reactions. On November 28, the World Health Organization (WHO) says there was still unclear whether the new variant of Omicron is still transmissible than other variants of the COVID-19 virus or whether this variant causes disease heavier or not. Preliminary data suggests an increasing rate of hospitalization in South Africa, but this may be due to an increased number of people becoming infected, rather than the consequence of the infection with Omicron, the WHO statement says. However, WHO reiterates preliminary evidence that there may be a high risk of reinfection with this variant. WHO is currently working with experts to understand the potential impact of the Omicron's variant on current response measures. WHO noted currently there is no information to suggest that Omicron-associated symptoms differ than those associated with other variants. Omicron infections were reported initially among university students. Younger people tend to have less illness. Still, they have to understand the severity of the Omicron variant will last a few days to a few weeks. Continuing with the world's response to the Omicron variant, on November 28, the Indian Ministry of Health revised the visitor regulations effective from December 1st. Specifically, international guests must submit 14-day travel itinerary and upload a negative COVID test result on the Air Suvida online portal. Passengers coming from high-risk countries such as Europe, South Africa, Brazil, Bangladesh, Botswana, Zimbabwe must take a test immediately upon arrival and wait the test result at the airport. If negative, they must self-isolate for 7 days at home, test again on the day 8, self-monitor for another 7 days. Passengers arriving from countries not listed above will be allowed to leave the airport and must self-monitor their health for 14 days. That's all the news today. Thanks for watching us. Have a good time. Goodbye.